So the government's today published a new report into the illegal drugs market with findings of £9.4 billion a year is the business worth to criminals selling it on the market, and it costs the nation £19 billion per year in health, crime and societal effects. We're joined by the report's author, Dame Carol Black. Good morning.
Good morning.
This report paints a pretty bleak picture of drug use and rehabilitation in Britain. Were you shocked with what you found?
I was shocked about some parts of it, but I think having looked at the picture, I now want to move forward to the things we can do to make it better. And there are many things we can do to make it better. So I would take a forward-looking view, even though the facts are in many ways uncomfortable.
Do you think the government realised the situation was this bad?
I'm not sure that all departments of state realised exactly where they were, and that may be because it's very important for government departments to talk to each other. And I would suspect that the national statistics as they came out would have informed them. But I think what our review has done is actually looked very carefully at each drug type. We've looked at the value of the drug, the damage it does, and then where the government intervenes.
So looking at the report now, one of the areas you draw out is the challenge that law enforcement faces. And I think you suggest that that's never going to be enough to focus it. The current incumbent of the Home Office, Priti Patel, is very focused on law enforcement and reiterates again and again that the police are the answer. But your report seems to suggest otherwise. Who's wrong?
I don't think either of us are wrong. I think you need law enforcement. You need a real attention to reducing the supply of drugs. So that, of course, comes into Border Force, National Crime Agency, policing. But you also need to reduce demand. So you need to put in prevention, you need to put in better treatment methods, and you need to think about recovery. You need both. One of these will never answer this pretty thorny question.
It seems like a lot of your analysis comes back to austerity. Is it fair to say the government is all to blame for this situation?
I think in the last 10 years we've had quite a lot of austerity. That has obviously impacted on what I've found. So that will be part of the problem, but the other really important issue is that for heroin and cocaine, which are the two most dangerous drugs, they've flooded the market, they're purer, we have more of them available, and they're cheaper. So it's been almost like a perfect storm that we've had excessive supply, increased purity, greater demand, lower prices, that is then met up with many protective factors being diminished.
And the report is full of the problems, but seems quite light on the solutions. Do you personally believe the situation is impossible to fix?
I don't think the situation is impossible to fix. I did in part one what I was asked to do, which was an analytical review of supply and demand, to really look in depth at what was driving the increased supply and the increased demand. That I've done. It isn't high on policy. It certainly hasn't looked at treatment and recovery in depth, but I don't think it's at all impossible. I think with good cross-government working, with all of the relevant departments working closely together, you could make a difference, and that you could make a difference quite quickly.
And do you think the ambition is there? Do you think government is willing to go to the lengths that it must?
I think from my conversations with this government, to whom I'm presenting this review, yes, I do think they've accepted what I found based on evidence, and they're very keen to take it forward.
And a lot of this kind of seems to come back to the idea that you're trying to tackle something that is growing in demand, that there are millions of drug takers across the country. Other parts of the world are starting to move to legalise drugs. What do you think? Is legalisation the long-term answer to this issue?
Well, of course, in my terms of reference, I couldn't consider legalisation, so I don't think I'm going to discuss it with you today.
Was that a mistake to not include it, do you think?
that was the choice of government. It wasn't my decision.
Okay. Dame Carol Black, thank you very much. Okay, so this is BBC Breakfast. It's,
On the couch.
On the couch, 10:08. We've got the England rugby team coming up, but first off, we're going to chat to Dame Carol Black, who today the government has published a review into the illegal drugs market in the UK. Thank you very much for coming up to Salford, how to be with us this morning. What did your report find?
My report found that illicit drugs, which have been around for a long time, are now at an all-time high in this country, and they are certainly causing more harm than ever before. So drug deaths are at the highest that they've ever been recorded. We have more people sleeping rough and dying on our streets. The complexity of the drugs that you can buy, either from a dealer or indeed you could buy online. Buying in many ways. Social media has played a really important part in this, and that our prisons are overfull with people who've been addicted to drugs, who are there for an acquisitive crime and often rotate in and out of our prisons and may leave prison worse than when they went in. And then finally, but really very importantly, our treatment and recovery services are worse than they have been for 10 years.
One of the things that we picked out from the report is the details you go into county lines, this new phenomenon. For the audience of home that aren't familiar with that, can you explain what that means?
Yes, county lines is a way in which drugs are taken, if you like, from urban areas, so say taken from London to Margate. We've been used to having dealers of drugs in our big cities, but now what they've been doing is taking drugs mainly to our coastal towns. So they've spread virtually throughout the whole of the United Kingdom. And whereas to start with, they used urban young people to take the drugs locally, they are now recruiting in our county, in our seaside towns, taking young people who will also do the drug running for them at a local level. So it's really a delivery by organised crime gangs of drugs, really to almost any part of the country.
So families kind of hearing of us today will be extremely worried if children are being drawn into this world. Are they right to be?
I think they are right to be worried. The children who are most at risk are the children who have grown up in troubled families, that have perhaps been in care, children who found their educational needs not met and may be excluded from school. So if you like, children who are vulnerable in any way are really easy pickings for these gangs. Having said that, we also know that the gangs go after children who grow up in very normal homes and have a good education. So it's not exclusive to children who are vulnerable. They also are approaching and indeed recruiting young people who think this might be good for their image, they will get more money. And although I don't have hard evidence, there is anecdotal evidence that they are infiltrating our universities.
So if we kind of touch on the vulnerable children that are being drawn into this, and if that's maybe the majority of the young people, these are some of the most vulnerable children in society. And it seems like from your report that a lot of these services that are in place to protect them from these gangs have just simply disappeared. Is the government to blame?
I think local councils, who would of course be providing those services, have been under tremendous pressure to cover all the things that they have to do as a local council. I think it would be fair to say that protecting these children has probably gone down their list of must-dos, so they've deprioritised it. They make their decisions, they make their choices, but certainly I believe it is their reduced capability, their reduced financial resources that has led to these services being cut back and deprioritised, and I personally think that should be reversed.
So let's move on then to the solutions to this problem that we face as a country. What changes do you personally hope to see?
Well, I very much hope to see, first of all, that the Home Office, who commissioned the review, will pay attention to the things that need to be done for their border force, for the National Crime Agency, and for policing, because that is within their remit. I think when it comes to the health needs, we first of all need to do a more in-depth look at where treatment has got to and where our recovery services are. I would be in favour of thinking about some sort of central control over local delivery, because at the moment we have a system whereby local services are delivered to the cheapest bidder, and there are really no controls over standards, and therefore you have a whole variety of services which don't really meet the needs of the local population who are addicted. So I would want to see some considerable changes at that level.
And I guess that touches on some of our viewers' fears about a trade deal with America and the impact that could have on the NHS. Do you think the drug rehabilitation changes signify the kind of emergence of new practices in the NHS?
Well, I don't think it will necessarily be within the NHS, because when you think about it, our drug services commissioned by local councils are often not commissioned through an NHS service. They're commissioned through local companies, local charities. And I think therefore it's not just an NHS problem. The NHS services are put under most strain when it comes to dealing with the health problems of addicted people, which are not related to them just taking drugs. So their heart disease, their lung disease, their liver disease. That is really when the NHS is called upon to really provide services.
Okay. Well, thank you very much for coming in, Dame Carol. Over to Carol for the weather. So I think my questions now won't be in the clip. If you imagine my answers aren't in the package, so try and always include the question within the...
You want me to repeat the question to you, Ben?
So the difference would be like if you said, what did you have for breakfast? And you said porridge. Oh, I had porridge. On this one, if you could say, for breakfast this morning I had porridge. So it works as a standalone.
Oh, I see. So you can just use it.
Just your answer, not my question, yeah. Okay, what did your report find?
My report found that illicit drugs have increased in number, in their danger, and it found that the harms due to illicit drugs are complex and increasing, that treatment and recovery had diminished, and many more children are at risk of joining gangs.
Is the government to blame?
I think it's a rather perfect storm that we've had an increased supply of drugs, greater purity of drugs, more people taking them, and lower price. And then we've also had austerity measures. So the two things together have left us in a rather difficult position. I do believe the storm won't abate unless the government takes action.
What needs to happen now?
I think the government needs to absorb what I've written and said. I believe a cross-government approach needs to be taken so that each department that has a responsibility within this drug field really comes up to the mark and takes action.